you doing, guys? My name's Sam. I'm a physiotherapist at the Mitcham Rehab Clinic, and today we're going to talk about some shin splints. So obviously shin splints are a really generic type term for what physios in physio kind of terminology is called MTSS, or medial tibial stress syndrome. So there's a few little tips and tricks that we can give you today to be able to figure out perhaps how to identify it. Some easy type things that you can either instruct your patients or players, whoever you're working with, things that they can do for themselves. Perhaps a few things that you can do in terms of on the sidelines or when you're doing stuff with them for training. And then I guess also knowing when to refer on to either ourselves, podiatrists, in terms of your shin splints, or doctors as well. So we'll go through all of that and just try and work our way through it. Hopefully it's informative for you and you get some stuff out of it. Alright, so I think perhaps as one of the first things to think about with your shin splints as a bit of a broad term is that a lot of the time your players will come in and say, I have shin splints. And it's obviously a really common term that people know about. It's the thing a lot of footy players have it, a lot of other sports get it. And so it's just a term that everybody uses. But just because somebody comes in and says to you, I have shin splints, doesn't necessarily mean that they perhaps have, as I said, what we would call MTSS. So there's perhaps a few easy little tips and tricks to be able to identify that a person probably does have that MTSS or shin splints. A lot of the time people, if they do have that condition, they'll come in and they'll have, normally in the distal third, so the lower third of your tibia or your shin bone will be quite tender and sore. It's not uncommon to have the pain further up, but it's a lot of the time quite distal, the lower third portion of that of your tibia. Most of the time, as a bit of an assessment that you guys might do, if you palpate along that, so if you just put your hand, with really kind of broad 3 or 4 fingers, if you just palpate along the lining of that bone, and you won't have to go very hard at all, somebody that's had shin splints for quite a long time, it's long-standing type stuff, it's almost chronic, will be really quite tender, and you won't have to press very hard at all, and they'll jump through the roof. Just make sure that the leg isn't too close to it, or you might cop one near the face. But as I said, you won't need to press very hard, but you may either feel, and like you do in any other muscle group, you'll feel some tenderness, some tightness rather, and they'll explain that it's really quite tender. The reason for that is part of the physiology that's going on within the muscle group there, is you've got your soleus muscle, as well as tibialis posterior, which might be a muscle that you're familiar with that goes along, it's kind of deep to your tibia, but it goes along there and then underneath the arch of your foot. Those muscles, when they are overworked, so it's either a lot of the time can be an increase in load, or perhaps it's incorrect footwear, and we can talk about that one a little bit later as well. But then what happens is you get an inflammatory response, because what happens is the muscles, where they align onto the bone, you end up getting those muscles pulling away from the bone because they're really quite tight and they're actually not quite effective for the kind of work that you're doing. So you get this real inflammation around that area. Then obviously once that's happened, you keep running on it, you keep playing, you keep training a couple of nights a week, you just get this build up and that just keeps happening. And the idea is with this that you want to try and get on top of it as quickly as you can, so that it doesn't snowball into something that lasts for the whole football season. If that's your sport, netball, a lot of your court sports is going to be fairly, you're going to see that a lot among a lot of your players.